So now it's my pleasure to introduce our final speaker. She is a graduate of speech communication from the University of the Philippines in Diliman and has been a speech communication training specialist since 1990. She is the founder and communication coach of her own firm, CLI Training Consultancy, where she conducts in-house workshops in public speaking, English proficiency, conversational fluency, personality development, and customer service, both in the Philippines and in Singapore. She also runs communication programs for students at all levels and one-on-one coaching for the professional level. Beyond corporate work, her heart is also in service. CLI Training Consultancy proudly supports corporate social responsibility efforts, and she has previously served as lead ambassador of the BNI Foundation for 3 years. But beyond her professional accomplishments, she is a devoted mom to her two daughters, Daniel, who is now 30, and 21-year-old Sandra, who was born with Down syndrome. Since then, she has become a passionate and parent advocate for children with special needs. She was a contributing writer to the book Nanay Knows Best, inspiring stories of empowered Filipino mothers, curated by Janice de la Cruz. Drawing from her own family's journey, she delivers awareness talks that emphasize respectful and inclusive language, because every child, regardless of ability, deserves dignity and understanding. So please welcome Bobong Kachanko.
Thank you very much. Inhale, exhale. It's always difficult to be the last speaker because it's like I'm full of emotions after listening to three moms, and it's like this is my first time to hear their story. Ours is a journey that is quite different from yours, shaped by the unique needs and constant attention our children require. I speak not only for myself, but also for other parents of children with special needs. Sandra, our second daughter, who is 21 years old now, was diagnosed with trisomy 21 from the time she was born. When the doctor already noticed that she had features of a child with Down syndrome, a chromosomal test was done. And this is when it was confirmed that she has Down syndrome. The latest statistics show that there are, as of 2025, each year, an estimated of 3,000 to 5,000 children are born with Down syndrome globally. And in the Philippines, Down syndrome is a significant public health concern, according to the Down Syndrome Association of the Philippines, with approximately 1 in every 800 babies born with Down syndrome. This translates to about 1,875 new cases annually, or roughly one baby born every 4 hours with a condition. Additionally, it's estimated that there are around 250,000 individuals with Down syndrome in the Philippines. Down syndrome is an irreversible condition which occurs at the moment of conception. This has nothing to do with what the mother did or did not do during conception. And 50% of babies born with Down syndrome have a hole in the heart. We are just so blessed that Sandra's hole in her heart closed by itself when she turned 1 year old. There are many health issues associated with Down syndrome. As for Sandra, it's visual problems. Without her glasses, she won't be able to see well. So we visit the ophthalmologist every year. Oh, that's not the doctor. That's Sandra's father assisting. Doing chores, house chores in particular, is a shared responsibility in the Kutyonko household, especially during the weekend. While we do dishes and clear the table, Daddy bonds with her in watering the plants and vacuuming the floor, as well as in fitness activities. Sandra loves music and dancing, And this has become one of our bonding moments as well. The moment she hears a familiar tune, she starts to dance, whether she's at home, in public, or even just part of the audience at a school program. Sandra loves singing too. It was through sing-along time where Sandra was able to read more words.
When there's no getting and where you go, when my smallest dreams won't come true, I can't take all that the world has to give, but I won't have to take without you.
And who wouldn't want to receive free hugs from this sweet young lady? It comes naturally when she knows that you like her and if you have a big tummy. So don't be offended, okay? Any trip to the hospital is a nightmare, especially during the pandemic. No amount of role playing made us successful in having a less dramatic vaccination experience. Imagine the sight of new people, all covered in masks, touching her hand, trying to explain to her the process, that all ended up with three big guys and the doctor cornering her on the floor just for her to sit still so they could administer the vaccination. And this happened for 3 times. A dental appointment is also one of our challenges. We're glad to have found a very patient dentist, Dr. Gian Flores, who is good in handling children. The experience needs to be pleasant for her to open her mouth long enough for the dentist to check on her cavities and what needs to be done. We were successful with just the first step. Step 2 can only happen if we have her go for sedation again and have the dental procedures that are necessary, but the clearances with other doctors have yet to be done. Her fear of dogs and cats, cynophobia and ailurophobia, has intensified over time. We often avoid places where she might encounter these furry pets, even if it means skipping family gatherings where dogs and cats are present. At the family farm, she's also frightened by ducks and chickens she sees, even if they are far away from her. We've tried to address her fears through an intervention with a special education teacher, as well as by telling her comforting stories and showing her animal toys. But none of these approaches have been effective so far. We hope that someday she can overcome this fear. In July of last year, we had a consultation with Sandra's developmental pediatrician. She was surprised by Sandra's lack of developmental progress. At 20 years old, Sandra was expected to have more developed language skills and responses. But during the brief assessment, these were noticeably limited. My husband and I share our observations of Sandra's repetitive movements, rocking, head shaking, and various other tics. Additionally, she experienced episodes of screaming, shouting, and crying without tears, which we initially assumed were imitations of her classmates. Another concern we raised was her difficulty in sleeping, as there were nights when she wouldn't sleep at all. A dance therapy program was recommended to us, and we have been doing this for 1 to 2 times a week. Dance therapy can help children with tics and hyperactivity by improving body awareness, reducing stress, and offering a structured way to release energy, which can lead to better self-regulation and coordination. We have seen some of the benefits on Sandra as we are on our 10-month in the program. She was also on a 1 milligram Respirodol dosage to help lessen the tics. And to address her delay in speech, we were recommended to have a speech therapy with a speech language therapist.
Alright, okay. Itaan ko lang po yung sentence. So you can say, I want to write.
I want
Yung pencil eh.
to write.
Pencil.
I want to write.
Okay, I want to write. Okay.
AAC, Augmentative and Alternative Communication, supports speech therapy by helping individuals express themselves, build language skills, reduce frustration, and improve social interaction when verbal communication is limited. We will hear more of the benefits of speech therapy later on from one of our guest speakers. We were told that there are recent studies on Down syndrome teenagers and older ones exhibiting signs of Down syndrome regression disorder, a mysterious condition that causes that previously high-functioning young people with Down syndrome to suddenly lose their ability to communicate, dress or feed themselves, use the bathroom, or even sleep. As mentioned by Dr. Stephanie Santoro, a clinical geneticist at the Massachusetts General Hospital, in her publication on healthcare for individuals with Down syndrome, Diagnosis to Adulthood, these are the young adults with Down syndrome who abruptly deviated from their normal development trajectory and experience unexplained rapid clinical deterioration. Some terms used are Down syndrome disintegrative order, new onset autistic regression, and acute regression of Down syndrome. Features exhibited are loss of daily living skills, cognitive decline, psychomotor slowing, disordered sleep, loss of speech, uncharacteristic anxiety, and new onset worsening, repetitive thoughts and behaviors. A consultation with Sandra's developmental pediatrician, Dr. Alexis Reyes, very recently focused on Sandra's upcoming medical workup, which aims to establish a comprehensive baseline and define a clear path forward to address potential regression during the adult transition phase of individuals with Down syndrome. To make this happen, we will be guided by a team of doctors, a clinical geneticist from Massachusetts General Hospital whose expertise is in adult transitions for individuals with Down syndrome, who will provide valuable guidance in refining Sandra's workup and long-term care approach. As of today, we have also witnessed that Sandra her tics could be caused by having Tourette-like syndrome. So we will be guided by a team of doctors. She will be confined for 2 days at the hospital with a medical team and key specialists, an endocrinologist, anesthesiologist, neurologist, psychiatrist, and immunologist. All key preparations are in motion. Medical, diagnostic, and logistical aspects have been covered to ensure Sandra receives thorough, coordinated, and patient-centered care. And this is the reason why I have given up my workload as well as my organization, BNI, that I have been with for 6 years to give Sandra my undivided attention. In our 21-year journey of raising Sandra, there are many life lessons I wish to share with you, along with heartfelt messages to our dear family and friends. Messages I hope can help make the world a better place for individuals with Down syndrome. We are offended by derogatory terms such as retarded and mongoloid, which is an obsolete medical term. These terms are hurtful to the special needs community. The child is a child first before the condition. Handicapped is considered outdated. Let us focus on their abilities and support needs rather than their limitations and inabilities. Here is a list of more appropriate words to use. Put the person first by respecting their identity beyond the condition. Take a screenshot of this to help you remember, and probably could share it on your social media. If you are a special mom, be the voice of your child, especially if your child cannot step up for himself or herself in fighting for when they are bullied or when fighting for their privileges. If you have a story to share in raising your child, write it down. Keep a journal. Maybe you can write a book or be part of an awareness lecture like this. It is important for you to take care of yourself, especially your mental health. If you are tired and going through some stressful episodes, find the me time you need. Go to the parlor, watch a movie, go to your dermatologist. Come on, ladies, lipstick is life and your eyebrows is life. Kilay is life, as we say in Filipino. More importantly, have someone you can share both your happiness and woes with, or look for a support group. A loving family is like a team, with each member playing a unique role in a child's growth and progress. For instance, when it comes to Sandra's diet, consistency is key. If the doctor recommends cutting down on sweets, both mama and daddy need to follow through. We shouldn't eat her favorite cakes and cupcakes. She's watching. Off-limit treats in front of her. Among us, it's actually Ate Lorna who is the most disciplined. She faithfully prepares Sandra's healthy meals, doesn't offer her sweets, accompanies her on a walk 4 times a week, and attends dance therapy sessions with her, while Mama is at work. Ate Lorna is truly a blessing to our family. The role of a sibling is vital in the development of a child with special needs. Ate Daniel and Sandra are 9 years apart, but their bond remains strong. Even now, while Ate Daniel is based in Singapore, she makes it a point to stay connected through regular video calls. During the pandemic, Sandra was even her student in an online class. It was truly heartwarming to see them learning and laughing together on screen despite their being miles apart. Another blessing in the family is having the second geneticist in the Philippines, who is Sandra's aunt, and the most sought after developmental pediatrician, Dr. Alexis, a dear family friend. Both of them were with us since Sandra was born, and they would always make sure that Sandra reaches her maximum potential by recommending to us the best therapists and doctors. Thank you, Dr. Eva and Dr. Alexis. And of course, our beloved Kutyongko and Lacanilao families, whose unwavering love and support have been our strength throughout our journey in raising Sandra. And these are the most recent photos of Sandra at ILLC, where she took part in the Recognition Day and the School Sports Fest. ILLC has been a nurturing environment filled with loving, dedicated, and patient teachers who have played a vital role in Sandra's cognitive and social development since grade 3. And now, in less than 2 weeks, she shall be moving up to grade 9, a milestone made possible by the unwavering support and belief of those who are around her. To the ILLC teachers who are present today, thank you very much for seeing beyond grades and focusing on Sandra's uniqueness, her growth, and her potential. And I'd like to spotlight Sandra to be with me and share the stage with me. I am sharing my screen with Sandra. Spotlight.
Welcome, it's me.
Okay. Let's take out the... All right, thank you. Sorry.
Thank you so much.
Sandra is a gift, a gentle light in our lives. She has taught us the quiet power of patience, the grace of kindness, and the beauty of walking beside her, not ahead. We've learned not to chase perfection, nor to measure success by grades or praise, but to cherish the smallest milestones, the tender victories that speak volumes. In these moments, our hearts rest easy, knowing that she is held by a world that loves her, fully and unconditionally, through her fears, her meltdowns, her quiet struggles, and her silent triumphs. Even in tribulation, she shines, and in her light, we find our own strength. And so we invite you, our family, our friends, our community, to reach out to us to help build a world that celebrates differences, embraces challenges, and offers every child, especially those with special needs, the dignity of being seen, heard, and deeply valued. Sandra, say hi to everyone. You have a lot of new friends today. If you'd like to connect with me, take a screenshot of my contact details, and I would be glad to be invited to your group, your company, or organization, and together with the rest of the moms, so we could deliver this awareness talk. We believe that the more people we're able to reach out to, we will have a kinder, more understanding, and more accepting society.